I had this idea for a show. Different women, different points of view. Maybe a little too different. We call it The View.
Well, summer is almost here, and as we just saw in the last segment, the fashions can call for showing a lot of skin. But women suffering from varicose or spider veins often feel way too self-conscious about showing any skin below the waist. Well, not anymore, because there is a brand new laser treatment that'll have you back in a bathing suit fast. Here to tell us about it is the developer of this new procedure from the Vein Treatment Center, the main vein man himself, Dr. Luis Navarro. Welcome, Dr.
Good morning,
Navarro.
and thank you.
Let's start out by defining these two terms, varicose versus spider veins. What's the difference between them?
Varicose veins are bulging, rope-like veins in the legs of about 10% of the population due to failure of the main vein and its valves. We see here the main vein, which is the longest vein in the body, runs from the groin to the ankle, and when its valves fail, blood falls back down, pulls into leg veins, causing them to bulge and become varicose. On the other hand, spider veins are very small, thin capillaries, blue or red, found in about 40% of women's legs.
40%?
And that increases with age.
Okay, are spider veins or varicose veins painful?
Spider veins are usually just unsightly, maybe embarrassing. But varicose vein will give rise to achiness, heaviness, tiredness of the legs, even ankle swelling and night cramps.
So is it hereditary?
People that have varicose and spider veins are born with a predisposition to weak veins, which tends to run in families.
Okay. Well, you pre-selected two women who had surgery because they were unhappy with the way their legs looked. We're going to start with Fabienne, who had severe varicose veins. I see the roping that you were describing earlier. What did you do to Fabienne?
Fabienne had large varicose veins, and the treatment traditionally for her would have been hospital surgery, the stripping or pulling out of the main vein.
Right.
But over the last couple of years, I developed a new treatment for large varicose veins that uses laser technology to deliver laser energy directly inside the vein to close the main vein. Instead of pulling out the vein with surgery, we close it with laser energy.
Okay.
Yes, here we'll see that in the office under local anesthesia, with help of the ultrasound, we pass a catheter inside the vein, we pass a laser fiber inside the catheter, and we release laser energy in short pulses, closing the main vein.
Okay.
You don't need the vein?
No, not really.
So we're watching it actually happen.
An actual procedure that points to the faulty valve at the groin. We mark the leg, and with local anesthesia, we will insert a catheter and a laser fiber into the vein. We position it properly, and then you'll see the glow of the laser energy through the skin. That's a broken valve seen directly from inside the vein. That's the laser fiber, and that's the laser energy which will seal the vein from groin to knee, avoiding surgery.
How long does it take to heal, and are there any side effects?
Patients walk right out of the office and return to the normal daily routine immediately. For about a week, they have some black and blue and maybe some stiffness in the area of the vein. That's all.
And how much does it cost?
The procedure costs between $2,000 and $3,000, but treatment of large varicose veins is considered non-cosmetic and should be covered by insurance. Yeah.
All right, so now we saw the before. Let's look at what Fabienne looks like now. Here.
Should look much better.
Okay. Look at this split
Thank you, John. How are you?
Your legs look gorgeous.
Yeah, I mean, this is amazing, the difference.
This was
Much better. How do you feel? Did it hurt you at all? Did you feel?
It didn't hurt at all, not during the surgery, not after the procedure, and I'm very sensitive, not even a painkiller taken.
So you would do it again?
Nice. Absolutely.
Did you get insurance to cover it?
Part of it.
Part of it.
Yes.
Okay.
Now, is she likely to get it again if she's predisposed in another leg, or?
Patients that have, varicose veins and vein problems have a predisposition. So spider veins tend to come back. Varicose veins, they can come back, but not so more unlikely.
Let's actually move to spider veins, because our next patient was Tamara, and Tamara had spider veins. So tell us, we're looking at Tamara's leg. What did you do to Tamara?
She had spider veins, and the treatment for spider veins is sclerotherapy. That's the injections of a chemical compound with very fine needles And this compound will irritate the inner lining of the spider and will close the vein and make a
It just
collapse and
zaps it
disappears.
right out.
Here we see the actual injection of the chemical solution, and you'll see the spider disappear.
This seems a little easier treatment, is
Yeah,
it? It's
much
much
more.
easier.
Oh,
And the
my
blood will be
goodness.
rerouted
Look at
to a
that.
healthy vein.
Amazing.
Wow,
That
that's
is
incredible.
amazing.